Over the next few segments, we will be discussing various topics, subjects that are often overlooked, neglected, and rarely addressed. What I'm referring to here are anxiety and mood disorders, and even depression. We'll even go as far as discussing the physical changes associated with menopause, namely skin changes and weight gain. And let's not forget the less obvious symptoms of menopause, which can include issues with bone structure, bone loss, and osteoporosis, as well as the cardiac diseases that can also manifest during this vulnerable time. My guest today and for the coming segments is Dr. Radomir Jarcevic, an authority on menopause with a subspecialty in the field, and works at the Maison of Rosemont University Health Center. Dr. Jarcevic, welcome.
Thank you for having me.
If you agree, I'd like to discuss somewhat challenging topic of mood disorders that can appear during menopause, including anxiety and depression. What's your experience with these issues?
I think it's very important to talk about this because it's a subject that patients often bring it up in our clinics. As we know, women are at a much greater risk for mood disorders, such as depression or anxiety, than men. This is especially true during periods of hormonal changes such as peri-menopause. It's also true during menstrual and premenstrual periods, where women might also experience fairly acute mood disorders. So, there is a certain fragility that is specific to women, and it is especially present in perimenopause, when this fragility can be heightened due to hormonal changes.
I imagine that there are also other factors that may accelerate these symptoms in women. We know there are hormonal changes, but do you think this is the only explanation?
It's part of the story, but it's definitely not always the only reason. Patients or women with a history of these disorders, like depression and anxiety, have a far greater risk of experiencing them again at the onset of menopause. There are also environmental factors, which are basically social causes, or issues related to work or family.
When do you think we should be concerned, and when do you think one needs to seek out medical advice?
I think you can see a doctor at any time, and then assess if the symptoms require monitoring or medical treatment. Sometimes, just talking about it can be reassuring, clear things up for a lot of people. But I think you should definitely see a doctor if or when symptoms become a nuisance and disrupt daily life, or when they severely impact your quality of life. A consultation can offer the tools to get through a difficult period or address certain symptoms that might not necessarily have a definite underlying condition as the root cause.
Do you believe that hormonal therapy can play a part in all this?
We talked earlier about causes, and we know that during perimenopause and menopause, many women experience symptoms that can affect their quality of sleep, for example. So, if you're not sleeping well, this might lead to decreased performance at work, maybe greater irritability. In these cases, hormonal therapy can really help. If we can alleviate vasomotor symptoms and help improve the patient's sleep, then she might ultimately recover better at night, and then function better during the day. For some patients, this can be a part of the solution, since the cause is not actual depression, but rather a consequence of the transition that they are going through.
Dr. Jarcevic, do you think there's room for other, non-medical treatments?
Absolutely. I think patients can explore different possibilities to find solutions that can give them relief. So, we can think of other, different types of therapy like relaxation, yoga, cognitive behavioral therapy, or mindfulness as extra tools.
Yes, a multimodal approach can sometimes provide additional relief. Thank you for this very useful information.